Hi, I'm Dr. Melanie Palm from Art of Skin MD in Solana Beach, California. Today we're talking about Sculptra. This is actually the third of 3 videos on Sculptra. We've already talked about the upper face, treated the mid face, and now we're going to talk about the lower face. So actually the lower face undergoes a lot of volume loss. So we actually lose bone along our jawline over time, and then we also lose soft tissue support such as fat in our face, which starts to age the face. We get telltale nasolabial folds and some changes which are called the marionette lines over time, and sometimes people can even get a little bit of a mental crease. And so in order to correct that, I often talk to patients about Sculptra, which is a longer-term volumizing agent. It actually harnesses the body's own ability to produce collagen over time. So it's your own body doing the work and actually volumizing the face. It's very natural looking since it's yourself, and it's a longer duration. It lasts about 25 months according to the FDA labeling. And so this patient's nearing the end of her Sculptra treatments. We've already done several sessions, but I just want to touch up a little bit in our nasolabial fold, this area that we call the piriform aperture or canine fossa, and then we're going to do a little bit in this jawline area too. So we're actually going to start in the chin. I'm going to do one little entry point from down below the mandible, little poke, and then I use a phone or a fanning sort of technique to slowly volumize. I'm just putting a very small amount in that area to sort of lift, and I'm going actually all the way over to there. So that's it for that side. Now we're going to actually move on to treating the nasolabial fold. So you just want to put a very small amount in that area. So I'm going to do a little poke from here. 1, 2, 3, poke. You always want to be medial to the crease when we do that. And then last but not least, I'm going to put a little bit in that area as well. So I tell patients when we treat that last little bit, there's just a teeny little poke next to there. So go ahead and breathe in, and then as you breathe out, we'll poke. Poke. I'm down on periosteum. I'm reflexing to make sure that we're not near a vessel. And you can see by putting a little bit in there, that actually brings the foot pad of the nose up. It rotates the nose upwards so it doesn't sink into the face over time. So that's the lower third of the face. We're going to move on to the other side. But if you have any questions or want to find out more, you can see us on artofskinmd.com.